Welcome to this lecture on Wuchereria bancrofti. Today, we are going to explore a fascinating yet devastating parasite that profoundly affects millions of people across the globe. We will uncover how this tiny worm hijacks the human body, understand its complex life cycle involving mosquitoes, and learn the mathematical tools doctors use to diagnose and combat the disease it causes. Let us dive in. To understand what this parasite does, imagine a bustling city with a complex plumbing system designed to drain away excess rainwater. If a massive ball of roots grows inside the main drainage pipes, the water has nowhere to go, causing the streets to flood. In our bodies, the lymphatic system acts as this essential plumbing network, quietly draining excess fluid from our tissues. Wuchereria bancrofti is like that living ball of roots. It gets stuck in our delicate lymphatic pipes, completely blocking the normal flow of fluid. Now that we understand how the plumbing gets blocked, let us look at the physical consequences. When these tiny, thread-like worms block the fluid from draining, the affected body part, such as a leg or an arm, has no way to relieve the pressure. As a result, it swells up massively, almost like a balloon. This terrifying and dramatic swelling is a clinical condition famously known as elephantiasis. It is a life-altering disease that causes severe pain and permanent physical disability. And incredibly, it all starts with just a single mosquito bite. Moving from the symptoms to the biology, let us formally define this organism. Wuchereria bancrofti is a parasitic nematode, which means it is a highly specialized type of roundworm. It is the primary causative agent of lymphatic filariasis. To survive, feed, and reproduce, this parasite relies on a complex two-host life cycle. It requires a human as the definitive host, where the adult worms live and mate. It also requires a mosquito, such as Culex, Anopheles, or Aedes, acting as the intermediate host and biological vector to transmit the disease. Understanding the hosts leads us to a fascinating evolutionary adaptation of this parasite. Inside the human lymphatic vessels, adult worms mate and release thousands of microscopic, highly active live embryos called microfilariae into the bloodstream. These microfilariae exhibit a brilliant behavior known as nocturnal periodicity. This means they specifically swarm into the peripheral blood vessels near the skin during the night. Why? Because this perfectly times their presence with the feeding habits of night-biting mosquitoes, maximizing their chances of being ingested and continuing their life cycle. Let us visualize this incredible journey with a diagram. On the left side, you see the human host. Notice the adult worms nestled inside the blue lymphatic vessel and the tiny microfilariae circulating in the red blood vessel. Now, look at the right side, representing the mosquito vector. When the mosquito takes a blood meal, it ingests these microfilariae. Inside the mosquito, they develop through stages L1, L2, and finally into L3 infective larvae. The cycle completes when the mosquito bites another human, injecting the L3 larvae into the skin. Having seen how the parasite spreads, we must consider its real-world impact. Lymphatic filariasis is a neglected tropical disease that affects millions of people worldwide, primarily in developing nations. Beyond the physical disability, it carries a devastating social stigma. However, because we understand its biology and nocturnal behavior, we can fight back. Health organizations like the World Health Organization implement mass drug administration programs and distribute insecticide-treated mosquito nets.
These simple but effective interventions break the chain of transmission, moving us closer to eradicating this debilitating disease from the globe.
To effectively treat the disease, doctors need a way to measure its severity, which brings us to the concept of microfilarial density. Conceptually, this is just the concentration of baby worms in a patient's blood. The formula is D equals N divided by V. Here, D is the microfilarial density, measured in microfilariae per milliliter. N stands for the total number of microfilariae physically counted under a microscope. V represents the exact volume of the blood sample examined. If the number of worms, N, increases, while the volume stays the same, the density, D, increases, indicating a much heavier and more dangerous infection. Now that we have our formula, let us see this with a concrete example. A doctor takes a thick blood smear with a volume of 0.02 milliliters at midnight. Under the microscope, the technician counts 15 microfilaria. We are asked to find the microfilarial density. We start with our formula, D equals N over V. We substitute 15 for N and 0.02 for V. Dividing by a small decimal is mathematically the same as multiplying by its reciprocal, so we multiply 15 by 50. This gives us a final density of 750 microfilaria per milliliter. This high number confirms an active, severe infection requiring immediate treatment. While diagnosing individual patients is crucial, public health officials also need to know how intensely the disease is spreading across an entire village. To plan large-scale interventions, they cannot just look at one person. They must evaluate the community risk. They do this by estimating exactly how many infective larvae a single person is exposed to over the course of a given year. This vital epidemiological metric is known as the annual transmission potential. Let us look at the mathematics behind this measurement. This brings us to the formula for the annual transmission potential, or ATP. Conceptually, this calculates the total infective larvae entering a person's body in a year. The formula is ATP equals B times P times L. B represents the total biting pressure, or the number of mosquito bites a person receives annually. P is the proportion of those mosquitoes that are actually infected. If P increases, the risk goes up. Finally, L is the average number of larvae delivered during each of those dangerous bites. Multiplying these together gives us the total annual infectious load. Let us apply this formula to a real-world scenario. Suppose a person receives 2,000 mosquito bites per year. Field studies show 5% of mosquitoes are infective, so P is 0.05, and each transmits an average of 2 larvae. We want to find the ATP. We substitute our values into the formula, 2,000 times 0.05 times 2. First, we multiply 2,000 by 0.05 to filter out harmless bites, revealing 100 dangerous bites. Then we multiply by 2 larvae per bite. The final answer is an ATP of 200 infective larvae per year. This massive infectious load indicates a severe transmission zone, requiring urgent vector control. We have covered a lot of ground today. Let us review the key takeaways. First, Wuchereria bancrofti is a parasitic nematode that blocks the human lymphatic system, leading to the severe swelling known as elephantiasis. Second, its microfilariae use a brilliant nocturnal periodicity to ensure they are transmitted by night-biting mosquitoes. Third, we learned how to calculate microfilarial density to diagnose patient severity.
And finally, how the annual transmission potential helps public health officials measure community risk. You now understand both the biology and the mathematics needed to fight this disease.